If you've noticed your teeth looking longer, it could be a sign of gum recession. As you can see on the monitor, the gum line slowly pulls back, gradually exposing the yellow root surface. If you've noticed your teeth looking longer, it's often due to gum recessions. As you can see, the healthy gum line begins to pull back, exposing the sensitive root structure, which is why teeth can appear longer and become more sensitive. As you can see, when gums recede, it exposes the dentin layer beneath. These tiny tubules lead directly to the nerve, which is why hot or cold sensations can cause sensitivity. Understanding gum disease is the first step to preventing it. As you can see, it starts with a perfectly healthy tooth. When plaque isn't removed, it hardens into tanner, which can only be treated professionally. This leads to inflammation, allowing bacteria to spread beneath the gum line, causing the damage you see here. Gum disease is a silent attacker, and it starts here. Your immune system fights back, but the battle damages the surrounding tissue. The toxins then destroy the ligament fibers that hold your tooth in place. And ultimately, the jawbone itself begins to shrink and disappear. As you can see, advanced imaging allows us to identify issues that were once invisible, like the bacteria forming deep perimetal pockets. Show me perimetal pockets. This is where the disease process begins, silently destroying the supporting structures of the tooth. As you can see on the monitor, we're measuring the pocket depth right here. The reading is 5.2 millimeters, which indicates a moderate pocket. This means the gum has pulled away from the tooth bit, and we're seeing some mild inflammation, which the AI is highlighting in real time. But there's no need to worry. This is a very manageable condition. We'll start with deep cleaning to remove the bacteria and plaque, and then we'll monitor it closely to make sure it heals properly. As you can see, we're generating a precise 3D map of your mouth in real time. The scan highlights some deep periodontal pockets, indicating an active infection. Our AI recommendation is a combination of deep cleaning and periodontal therapy. As you can see from your scan, the gum tissue has receded, which is why the tooth appears longer. The gum few the cancer gums, which is why the tooth appears longer and might be sensitive. Tooth sensitivity occurs when the dentin becomes exposed. Watch what happens when we introduce a cold stimulus. Quite common and perfectly normal. As you can see, the stimulus reaches the nerve, causing the sensation of pain. As you can see here, the scan highlights a progressive issue with the bone support around these molars. This means we need to be proactive with your treatment plan to prevent further progression. As you can see, healthy bone provides a firm foundation for the tooth, but when gum disease progresses, it destroys this bone structure. As the bone support decreases, the tooth becomes mobile, at risk of being lost. But the good news is, early intervention can stop this process. As you can see, the ultrasonic waves gently break down the tartar, allowing us to thoroughly clean the area without discomfort, promoting faster healing for your gums. As you can see, we're gently removing the bacteria and smoothing the root surface, which allows the gum tissue to heal and reattach securely. The most critical part of brushing is the angle. Hold your toothbrush at a 45-degree angle to the gum line, like this. Would you like to try? I'll watch. The most effective way to floss is to use a C-shaped motion, gently sliding the floss beneath the gum line. Sliding the floss beneath the gum line. As you can see, these are the results of your recent treatment. Your oral health has shown significant improvement across all key metrics. This is why regular checkups are so crucial for maintaining long-term oral health. As you can see, the results speak for themselves. Your gums have made a full recovery. This is what we can achieve together. Maintaining your oral health means knowing the warning signs. Let's review what to look out for. Bleeding gums, receding gums, persistent bad breath, tooth sensitivities, and loose teeth. If you're experiencing any of these, don't wait. Consult your dental professional promptly. Remember, your smile is your greatest asset. By staying informed and addressing issues early, you can ensure a lifetime of healthy teeth. Thank you for watching.